Hello students, welcome to Guide Grasp Up Institute of Dental Education, and here is Ilankumaran with a new video today titled Let's Make Anatomy Simple. For whom? For the first year BTS students who are going to take up their examination. In this module, we are going to learn the basic concepts of human anatomy and also the commonly used medical terminologies related to it. We will just have a quick look of the essentials of anatomy with which one can have a better understanding of advanced topics in anatomy. So, as we promised, let's make anatomy simple. How to make this anatomy easy? My dear students, to answer this question, you must answer this question. Why anatomy is difficult? Any guess? Because there are strange words in anatomy which is hard to remember and retain, and moreover, you may forget it when you go to your examination hall. So, if you have a good knowledge of these words or terminologies, and if you repeatedly study it with your diagrams and revise it with your atlas and MCQ books, anatomy is going to be easy. Okay, my dear students, let's solve the first issue, that is the strange words. Why the words used in anatomy are strange, which is not in our English books? Because the words used in anatomy are not derived from English, basically. These words are derived from Greek and Latin. So, these words are sounding strange for you. A good knowledge of these Greek and Latin terms will help you in better understanding of the subject. Yeah. My dear students, in this module, we are going to discuss the history and divisions of anatomy, anatomical positions and planes, terms for describing a body part, terms in bones, muscles and vessels, structure of the human body, body system and its functions. Starting with the history and divisions of anatomy. The word anatomy itself is a Greek word which was coined by Aristotle 2300 years ago. The English meaning of the word anatomy is cutting up, just cutting up. There are many important branches in anatomy, among which we are going to study the main 6 branches. First one, gross anatomy or cadaveric anatomy, otherwise called as macroscopic anatomy. The word itself means that you are going to study anatomy with the help of a cadaver. It is subdivided into regional anatomy and systemic anatomy. Regional anatomy means studying as head and neck, upper limb and lower limb, just for descriptive purposes. But systemic anatomy is studying as body systems, osteology, cardiovascular system and respiratory systems. Usually, the nursing students study systemic anatomy and the MBBS and the BDS students study regional anatomy because of their need. Secondly, histology or microscopic anatomy. My dear students, you may think, why should I study histology? There is a need. Only if you know the microscopic anatomy of the normal structures, you can compare it with abnormal structure. Thirdly, the next important branch is, here, surface anatomy. It's an important branch because it will be very useful in performing surgeries. All the description in the surgeries will be described in the form of surface anatomical markings. It will be very useful in giving injections, IV lengths, etc. So, fourthly, clinical anatomy or the applied anatomy. It is the practical application of anatomical knowledge in diagnosing a disease and of course treating a disease. So, you are studying anatomy, you are knowing the structures, and you must also know what type of disease the anatomical structure prones too. For example, you are studying pharynx. So why? Because as a oral surgeon, as a dental surgeon, you may see a lot of cases of pharyngitis, pharyngeal infections, etc. Your tonsil, tonsillitis, etc. So you must know the importance of treating that organ in the mind and then study the subject. Then anatomy will become a really easy subject in your dentistry. Fifthly, radiologic anatomy. We may take a lot of radiographs in the form of X-ray or a scan, CT scan or MRI scan, and you must know the normal structure again here to compare it with your abnormal structures. And at last, the embryology or the developmental anatomy. You may think, so what am I going to do with embryology? Am I going to do a test tube baby here after studying dentistry? Why should I study embryology, etc.? My dear students, it's not like that. We are studying embryology because you must know the growth of the oral cavity, teeth, face, and related structures, and then only you can compare it if there is any disease related to that structure. For example, there is a deficiency in the growth of the bone. So it may be because of a calcium deficiency, it may be genetic. So you must be able to communicate with your patients. You must have a good knowledge about this. So only if you study your embryology properly, you can understand this developmental defects properly in your third year oral pathology. That's why we study embryology. It's nothing but study of intrauterine development of a human being in the uterus, in the mother. That's all. So let us discuss some key points in the history of anatomy. In 400 BC, Hippocrates, who is called as the father of medicine, had a good collections in anatomy. Later, in the year 300 BC, Herophilus, who is considered as the father of anatomy, was the first to dissect the human body for study purpose. In 130 to 200 AD, Galen, who is considered as the prince of physicians, did volumes of work on anatomy, physiology, etc. In 1276 to 1326, Muntinus is called as the restorer of anatomy. In 1452 to 1519, Leonardo da Vinci, originator of cross-sectional anatomy, did lot of works in sectional anatomy. In 1514 to 1564, Vesalius, remember Vesalius is called the father of modern anatomy. So, Herophilus is the father of anatomy, whereas Vesalius is the father of modern anatomy. He is also called as the reformer of anatomy because he disproved some of the findings of Galen. So the main points given here are for solving your multiple choice question. So these may be some important questions for your multiple choice. So let's move on to the next subtopic, positions and planes. My dear students, let's do an activity. Here is picture 1, here is picture 2. Just mark the left side and the right side in picture 1. Just on the mind, and now mark the right side and left side in picture 2. There is some confusion, which is left hand, which is right hand. So to avoid this confusion, an anatomical position was proposed. What is that? A position in which a person is standing straight, eyes looking forward, both the arms at the side with palms facing forwards and both the feet together. So any anatomical organ described in the anatomy book is considered to be described in anatomical position. What is supine position? A position in which the person is lying on the back, both the arms are at the side with palms facing upwards and the feet together. Opposite of supine is prone. What is prone position? The patient is now lying on the face, chest and abdomen. Both the arms are at the sides and of course the feet are together. There are some other important positions which will be discussed in a separate video. Okay, let's move on to the anatomical planes. You may see a lot of planes: median plane, coronal plane, oblique plane, mid-sagittal plane. If it is confusing, please don't worry. Just hold on for some 3 minutes. We will clarify everything for you. Okay, let's take a break. What is the poster of Bahubali 2? What is in the hand of Bahubali and what is in the hand of Kattappa? It's the Bahubali sword, which is having a horse. And also the shape of the sword is T-shaped. So this is a clue for the first plane of anatomy. What is that? Here is Anushka to help us.
நீ செய்தது தவறு. பெண்களின் மேல் கை வைத்தால் வெட்ட வேண்டியது விரல்களை அல்ல, தலையை.
What has happened here? Bahubali has cut the head in what anatomical plane? Which is parallel to the floor. The anatomical plane which is parallel to the floor, and the body is getting divided into an unequal upper half and lower half. Okay. The plane that divides the body into upper and lower segments is called as, yeah, here is the answer, transverse or for horizontal. So, transverse or horizontal plane refers to a plane which divides the body into upper and lower halves, not essentially equal, right? And that plane is parallel to the ground, that's all. It is also called as a cross-sectional plane, otherwise it is called as a axial plane or transaxial plane. Okay, all these 5 words are meaning the same plane: transverse, horizontal, axial, transaxial and cross-sectional. So, I think you will be clear with this clue. Which structures are best studied in transverse or horizontal plane? What is the structure? Transverse section of neck. So, neck is best studied in this section. Maybe that's why Bahubali has made a section there. Okay. The name of the next plane which we are going to discuss is hidden in the figures here. And what is this? Am I doing any astrology class? No. Just find out the name of the next plane. It is hidden here. Yeah, students. I think you are close. You are close to the answer. Yes, it's Sagittarius, which is similar in pronunciation with your sagittal plane. Okay. So, what is Sagittarius? It is nothing but a bow and arrow. What does the arrow do? The arrow is piercing the body from the anterior part of the body and comes out through the posterior part of the body. So, any plane here, any plane which transverses from the anterior part to the posterior part and divides the body into right segment and left segment, it is called as a sagittal plane. Are you clear? If the same sagittal plane is dividing the body into equal half, it is called as the mid-sagittal plane. See here, the red line is the mid-sagittal plane and this dotted line is a sagittal plane. Sagittal plane can be anywhere, but it may not divide the body into equal. If it divides the body into equal half, then it is called as a mid-sagittal plane. Okay, it is also called as, the mid-sagittal plane is also called as median plane. And this sagittal plane is also called as parasagittal plane or longitudinal plane. Okay. Okay. So we are clear with the transverse plane or the horizontal plane. We are also clear with the sagittal plane. So the next plane is, before going into that, which structures are best studied in sagittal plane? Brain, muscles of the tongue. See here, the muscles of the tongue, the lateral wall of the nose are beautifully studied in the sagittal plane. That's why we study in different planes. Okay. Coming on to the next plane. What is this? Nothing but a crown. This is also a crown. Okay. But in Greek and Latin, it is not called as a crown. It is called as, what is this? Which is a VIP virus. Nothing but your coronavirus. Yeah. It's called as corona in Greek and Latin because this is crowned, this is crowned, and this is crowned. So what is this crown doing? This crown is dividing the body into anterior half or segment and posterior segment. So here is the mnemonic, a fairy with crown. Frontal plane, otherwise called as a coronal plane, is one which is dividing the body into anterior and posterior segments. Okay. A fairy with a crown. Fairy for frontal, crown is for coronal. This is the mnemonic here. Okay. Which structures are best studied in coronal or the frontal plane? Heart, kidney, and your paranasal air sinuses are best studied in coronal or the frontal plane. So, my dear students, I hope you are clear with all the three planes. What are some other planes which is their oblique plane, which is cross, not parallel to the ground? And what is cardinal plane? Any plane which transverses the body through the center is called as a cardinal plane.